Hello, and thanks for stopping by to view my poster. I'm just going to give you a brief overview of what I have here. My name is Olihe. I'm faculty at the College of Pharmacy, University of Minnesota, Duluth, and I will be talking to us about the COVID-19 needs assessment that we did with the African heritage community to address COVID-19 disparities. So the African heritage community comprises of the African-born immigrants and then the African Americans. And so, of course, we know that communities of color are disproportionately affected by COVID-19, and that is not new because we have had this health disparities persisting for such a long time, even before COVID. And we also know that underlying this are the social determinants of health. So our objective really was to just gain insight into the impact of COVID-19 for our community here in the Northland area and to seek some recommendations on how we can move forward with addressing those so that we can improve health and outcomes for community members. So we had a mixed methods approach. We had a survey that we conducted. It was a web-based survey. We had interviews with 30 individuals and focus groups, 8 focus groups with 49 individuals. And from the demographic characteristics, you can see that we had quite a wide spread. We wanted to get a very comprehensive and well-rounded perspective on what community members thought and how they felt about the pandemic and what recommendations they might have. So you will see that even with the age, we had focus groups with teenagers. And so our ages range from 13 to about 81 for participants in this needs assessment. So in terms of knowledge, you will see that there was considerable knowledge. People actually had, just a wide range of knowledge and good knowledge about COVID. There was multiple ways through which they received information. We asked about information sources. And so just depending on the demographic, there are people, of course, the younger generations who were more aligned with social media. So people just receive information in different ways. But one of the things that they really talked about was just having all this information being thrown at them and not knowing what was valid and who they could trust in terms of who the information was coming from. And so what we have done with this, because they did recommend having, a trusted source, and what we have done is to create the Health Equity Northland website where people are able to engage with us, in a bi-directional manner. And that is a place that also houses information. We keep updating it so that people are able to get timely information that they can trust the information because they know who it is coming from. So in terms of impact on the community, a lot of it was really, about the structural inequities that already were in existence. And for instance, with prevention, some of the challenges and some of the barriers, really had more to do with social, economic status and the types of jobs that people do, the types of housing, transportation, whether people ride the public transport or have their own private cars. So these are things that continue to just increase risk for some people and not for others. There was a lot of impact in mental health, exacerbations for those that already had mental health conditions, but it was just very stressful for the community, and especially with the things that happened within the pandemic that touched on racism a lot, that even was a greater stressor for people. Of course, economic impact, there was loss of jobs, things like housing loss, food insecurity, but I will say that the community did rally a lot to just make sure that they're addressing needs for people. And we could see that too. But there was also a lot of disruption in terms of community life, events that community usually has that brings people together, where they feel a sense of community, church services and the like, because communities of color really are more communal in terms of their culture. There's also the digital divide. And so when you talk about impact on things like education for the younger ones, and even access to services, because a lot of things have gone online. And so generally, there's just that equity piece where you continue to look at the processes that we have in place, the ways that we deliver care and other services, who does it benefit more and who is not able to have access to some of this. We did have a question on the survey about vaccine. And so it was interesting to see. So what you have here is numbers, not percentages. And so there were 183 responses. And so you have about a third of the people saying, yes, I would take the vaccine. At this time, vaccines were not available. You have like 2/3 really being in that category of maybe, no, and I don't know. And people who said outright no, actually more than those who said maybe. And so we already were beginning to see that vaccine hesitancy. And so in terms of the hesitancy piece, or just about vaccines, and a lot of people, their minds go to accessibility, but what we're hearing was not so much about the access, but the fears and the concerns that people have, and the distrust that they have, not of the vaccine, some are for the vaccine, but for the healthcare system, and then for government itself. We also heard, some things about what would motivate people. For example, just fear fatigue, tired of living in fear, like I'll just go get the vaccine so I can carry on with my life. And also there were people who were just outright, no, I will not get the vaccine because I just don't trust the government. And then there were a lot of conspiracy theories. So some of the key recommendations that we got, I've already talked about community education and just the risk communication coming from trusted sources. And we've implemented that. We are leveraging, just all community, the Black providers that we have, and getting them engaged in community education. We're having town halls. We're having what we call office hours with healthcare professionals. And then there was, just the recommendation to increase racial diversity in the healthcare workforce. So we continue to talk about the culture that we have in healthcare. And if there's just more diversity and then more people from these communities, when people coming for care, they're actually able to see people who look like them, people who come from their communities. And these people are also in a place where they're able to make input into policies and processes that would benefit their communities. There was recommendations about policy changes, just addressing the systemic, racism that we have, and the structures that continue to benefit some and disenfranchise others, and looking at these structures, because they all impact healthcare. We know from a public health perspective that they do: employment, housing, education, and so on. The last thing I just want to touch on is just leveraging community expertise. I can't say that enough, that community knows what community needs. And so for whatever interventions that we have or we want to, put in place, it's community that knows how best it will work, and being able to tap into that resource and remunerate them for that. And we have seen that with vaccination efforts that we have had. We have community liaisons, community outreach coordinators who they grew up in the community. They know the community members. We educate them, and they're able to, address concerns around the vaccine. And we've been able to increase vaccination rates by doing that. But I would say that a lot of support is needed because they put in a lot of hours and they put in a lot of effort into this. So this work was done, just a huge collaboration. And these are some, all the sponsors and collaborators that we had. It took a village to pull that off. So I wanted to acknowledge them. I just want to end with, just part of this quote that I have here on my poster that just continues to, we talk a lot about the historical distrust. And I want to say that we heard a lot about just contemporary experiences that people are having in healthcare. And so this individual said, once you go to the doctor so many times and you feel like you're being treated or mistreated, you're not being heard, you just stop going. And this is some of the things that we need to look at and address from a public health perspective. Thank you for stopping by and listening. If you have any questions, you can always email me. Thank you.